I first knew I had fibroids about 10 years ago when my OBGYN said I had fibroids. And so that was my first time really personally for myself. I knew about possibly 15 years prior to that, my mother had a hysterectomy. And I didn't know exactly why she had it. I knew she had fibroids because we had talked about it a little bit, but I didn't go into a lot of detail with her surgery until later on. But about 10 years ago, I had, what do you call that? A laparoscopic surgery to get rid of the fibroids that I had. And that's the first time I ever really started to look at my body, realize what I had, and that I needed to do something about it. When I had my fibroids, I felt, oh God, what word could I use? Angry. Because I hated the fact that here I am, an older person, my cycle should be slowing down, and it's constantly getting heavier and heavier and heavier. I hated the fact that I had to constantly buy Tampax and tampons. I mean, I should have purchased stock in the company. I know I kept that company in business. I had so much, and I still had to carry so much. Super Plus tampon plus a pad, and that will barely last me an hour. That was annoying, and I just did not like it. So my attitude around that time, I was not a happy camper. I had to constantly be conscious of where I am, what I'm wearing, and then the clock. Because if I'm at work and I'm seated, it's like you can't feel that you're overflowing. So then it's like, an hour's gone by, oh my God, and you start to panic. You know, you look up and you're like, oh God, here are your pants, they're soiled, because you can't feel it overflowing, and it would just make me, I would be so upset. So at work, I had to always make sure I had extra clothing, plus I kept a bag in my drawer. So I guess I can say how it impacted my life. It was very inconvenient. It was just inconvenience all the time. The number one symptom that I could say that I had was the heavy bleeding. The heavy bleeding, cramps. I had a lot of cramps too, more than normal. And then also, I would get backaches and the blood clots. So those were I guess I can't say that. You know what, I want to say number one, but I think they were all equally as annoying. So I don't know if I can even put a higher number of, more annoying symptom than the other, because they were just all equally as annoying. I did have another form of treatment for fibroids. About 10 years ago, I did have the laparoscopic surgery, where they had gone in through my belly button and lasered the fibroids off. And that was like I said, about 10 years ago. And I was really hoping, oh yeah, I'm done with it. But he did tell me, he said they will come back. And he was right. They came back with a vengeance. My decision really, I don't think it was really difficult, because prior to meeting Dr. Taheri, my regular family practitioner had said, you have fibroids here, hysterectomy. She just immediately hysterected me and had given me a prescription to go see some of her other, butchers, to take out my body parts, and I just wasn't having it. I'm like, I refuse. I don't receive that. I'm not doing that. Well, my experience with Dr. Taheri was great. I mean, he's warm, he's very informative, he has the charts in his office, so he goes over everything with you. He wants to really make sure that you are comfortable as well as knowledgeable about the various different procedures, the laparoscopic versus the UFE, versus even a hysterectomy. He shows you everything and how it would take place in your body and explains it step by step. And if you're not sure, when you come back, he'll explain it again. So he really wants you to be informed, he wants you to know, and as well as you should know. Because, you should ask the questions. And he always says, too, he makes himself wide open, says, if you have more questions, then call me. Let me know if there's anything else that I can answer for you. And that's what you need. You really need to know that. My experience with Dr. Taheri's office staff was great. I mean, when you walked in, they greeted you, you signed in. If you had any questions, they were there to answer. I loved the fact that they always called the day before to remind me of the appointments. I mean, because I started ripping and running, I forget to write things down, and I love the fact that it's like, okay, don't forget you have an appointment the next day. I really liked that follow-up. That was always great. And then after the surgery, I always got follow-up calls, and I thought that was great too. So the staff, kudos, and it's, all that stuff starts at the top. So if you have someone that's a great leader and a great encourager at the top, it's going to trickle down to your staff. There is a big difference from before the UFE until now, because now I still have a cycle. Unfortunately, I'm 49. I'm thinking, I should no longer have one. I wish I envy my girlfriends that say, "Oh, I go 6 months without a period." I'm like, what's wrong with me? Anyway, I guess from then until now, I would say that my periods have really, really not nearly as heavy. I probably go maybe 5 days, and I maybe have to wear. I'm trying to think if I even had to wear a Super Plus. I don't think I even had to wear a Super Plus. I have so many of them now. I wear them because it's like, what am I going to do with these things? So they're definitely lighter. I don't think they go quite as long as many as 7 days. And where before I was irregularly regular. So it's like every 20 days I would almost have a cycle, and it would go a full 7 days straight. Now I'm closer to back, 28 days, and it's not nearly as heavy. So, and I think every month it gets lighter and lighter and lighter. Yay. That part I'm really happy about. I would totally recommend friends and other patients and people that I know that are dealing with fibroids to really come and have a consultation, make an appointment with him, have a physical with him, so that they can, hear for themselves. They can see where they are within their body, and then they can make the same decision that I did, or at least make an informed decision as to what to do. I would highly recommend that they do that. My sister-in-law had a fibroid, and I didn't know this until after the fact, but she had a fibroid, I think, really large, maybe about the size of a grapefruit or whatever, and she had such a butchered job hysterectomy. They ripped her up her stomach. She has a scar from like her pubic area to her rib practically, and where they just ripped out her hysterectomy, and I just thought that was just brutal. And I'm wondering if she even had to go through that. So most definitely, if I can stop another female or woman or friend or colleague, relative from having to deal with that, most definitely. I really suggest that you seek help, seek the UFE, call Dr. Taheri, because it definitely works. You'll be much happier afterwards, and I think you'll be able to live a much productive life, much better productive life.